everybody. Thank you so much for joining us today. This is our very first webinar as the COVID-19 Long Hauler Advocacy Project. Today, we're going to be discussing the Biden-Harris administration's reports on long COVID and the role community engagement will play in our success. We will be going over where we stand, where we are, and where we can go all together. So thank you for joining us today. We're going to do this full circle look at where we are as a community and where we are currently in the works and the role you all will play in our collective success moving towards our collective futures. Tens of millions simultaneously disabled in the US meant a lot of voices bringing a lot of pressure and a lot of attention to an issue rapidly, much faster than anything else before, especially now with the power of social media. We went from asking each other about bizarre symptoms after COVID-19 infections to writing research, advising the government, drafting legislation, and getting a $1.15 billion study on long COVID in less than 2.5 years. While this has all happened much faster than for other chronic illness groups that came before us, it is still not enough nor fast enough. That is not cause to stop fighting, especially with all that is at stake, not only for long COVID, but for all of the communities long COVID advocacy, education, research, and support could advance and assist as well. We recognize that this year has been difficult in many ways, and we witness the new challenges that appear on the horizon that demand our attention and limited energy. We have observed a massive amount of community disengagement, low morale, and despair as our nation and the world pursues an urgency of normal strategy and forgets the devastation COVID-19 has and continues to inflict upon our communities. As advocates, it is our responsibility to work in partnership in order to re-engage our respective communities and ensure that tens of millions of individuals who are suffering from long COVID, along with millions of others suffering from complex chronic conditions, have access to the resources and assistance needed to live a meaningful and dignified life and to survive, to see the answers that come from the ongoing research and hopefully reach recovery or better quality of life. We need our community to get vocal as we advocate for education, research, and support for those suffering from long COVID and associated conditions. We want to emphasize how much we have accomplished and how far we have come while highlighting what's needed from each of you here today, your friends and family, and other community allies to ensure that each of these actions in motion now make it over the finish line or hand off the baton to the next effort in line needed to provide help and assistance to the long COVID community and beyond. We have great legislation geared towards addressing the wide spectrum of needs we've heard expressed by our community over the last 2.5 years. This legislation has been written and is sitting on the desks of hundreds of lawmakers at this very moment. We just need them to pay attention to it and sign on in support. There are a lot of political distractions. However, we need our advocacy teams to work to ensure their local lawmakers understand that despite polling regarding COVID-19, long COVID is still a major issue facing their communities and will be for years and decades to come due to its systemic effects. As you know, long COVID can greatly impact the lives of patients and their loved ones. While it has brought chaos into our lives, long COVID legislation will be the first step in bringing about a more equitable world in which post-infectious diseases and complex chronic conditions are properly researched, treated, and supported through adequate legislation and government resources. If we don't begin changing public policy now, then we may miss our window of opportunity to ever do so in our lifetimes. There are major efforts underway that demand our attention right now, not later, not in a few months or next year, right now. We are taking the approach of if not now, never. Not later, not in a few months, not next year, right now. If in this moment, with tens of millions of people simultaneously disabled from one event, if we cannot change policy in this country, we likely never will be able to. I'm not willing to accept that, and neither should you. Now is not the time to let off the throttle. Now is the time to apply more pressure. We have done tremendous work over the last 2.5 years. And if even more people got involved in the efforts happening now, the things we could accomplish would be monumental. And that is something that really excites us to think about, but disappoints us knowing that what could be isn't happening yet. So to get into some of the things that are happening, we want to start you off with where we currently are. Cynthia Adenig will be taking you through some of the current legislation that is out there and what that covers. And with that, I will hand it over to Cynthia.
Hello, everyone. Thank you for joining me and us here today. I'm really looking forward to breaking down what we have really done and worked for and our successes along the way with long COVID concerning Congress, and explain to you what's happening and what we need everyone to do to contribute to have more successes going forward. Next slide, please. So we need to talk about how legislation becomes law. So first you have a bill drafted, and it's introduced to the House. If it passes the House, it goes to the Senate. If it passes the Senate, it's introduced to the President. If the President signs off on it, it becomes a law. Where this is integral for us is we get to talk to legislators as they're drafting the bill and then give them our stories to tell them what needs to be added, because a lot of legislators don't have long COVID, so they don't know our struggles. And by telling our story, even when if they're not in bill form now, when they're thinking about a bill, they will often add some of our experiences to that legislation. I've seen it with that, and I've seen it also happen with the Biden task force with COVID and long COVID. So your stories really, really matter when it comes to legislation, because they're actually listening to us and adding important things from our stories to the legislation to help us. Next slide. So currently there are 4 pieces of legislation waiting introduced into Congress. It's the Treat Long COVID Act, the Care for Long COVID Act, the COVID-19 Long Haulers Act, and the Centers of Excellence Act. Next slide. So Representative Ayanna Pressley, she introduced the Treat Long COVID Act in April, and it was introduced in the House. That team did a wonderful job of sitting down with so many of us advocates, listening to our stories as the bill was in draft form, and really creating comprehensive legislation that helps us and really addresses our needs. For example, it authorized HHS $2 million for healthcare providers, and including community centers, health centers. It authorized money for grants funding and creation of expansion of long COVID clinics. As we know, we need an integrated system to work with all of our issues, not one individual doctor to individual doctor. So it would be funding a more integrated approach to our care, so we can stop running around specialist to specialist trying to find someone who cares for us. That's what makes this legislation really powerful and really helpful, and shows that you really, really listen. It provides funding for health providers to plan to engage in underserved communities. That's so important. As we know, communities of color really lag behind diagnosis and access to care. And so if they're able to fund and study and set aside money earmarked for those communities that really desperately need to know that they even have long COVID and to get that care, that's vitally, vitally important. You can read more of that, the amazing parts of the legislation on there, which also includes that, we are going to have treatment that isn't going to be denied coverage by our insurance. And I know a lot of us are experiencing that. And also it safeguards the other things that we experience from long COVID, such as MUCFS, dysautonomia, like POTS, and to make sure that all of our conditions are going to be covered and we're not on the hook for the bill and the insurance can't play around. Next slide. So Senator Tim Kaine, also awesome job. He, as some of you guys may not know, he has long COVID and he continues to struggle with long COVID. And so he went and had his team talk to a lot of his advocates as well, so that they can learn not just from his experience with his struggles with symptoms, but everyone's experience with struggles and symptoms. And they reached out to so many advocates to hear our story. That legislation, the Care for Long COVID Act, was introduced in the Senate in March. And it was, what's so great about it is you can tell that he really feels this because it's he's experiencing that. So one of the awesome things that's in there is that the Department of Health and Human Services must report to different agencies and conduct research on long COVID and our care, our long-term care. And what's also really helpful in that bill is that it requires multiple agencies to carry out research and other activities concerning individuals experiencing long COVID. So it's creating requirements for them to study us instead of having a wiggle room for them to, once things die down, people in spaces opt out of really prioritizing our health and our care going forward. And of course, he put in some things concerning Medicare and Medicaid services to expand their chronic conditions data warehouse and expand children's health care as well with long COVID. And that's really important. I know from those of us who end up losing our health insurance and end up being on Medicare and Medicaid, a lot of us are not getting proper coverage because that information and those standards have not caught up to what we experience. So that legislation is really vital. Next slide, please. So Representative Don Beyer and Jack Bergman introduced the COVID-19 Long Haulers Act that was introduced in the House in April of 2021. I actually was the first long COVID legislation that was created, and it was bipartisan. That's what makes this really stand out because, as you'll see, as I'll explain to you later, we really need this to be bipartisan. All of the other bills thus far, sort of my knowledge, have been all Democrats signing on to it as co-sponsors, but we need Republican co-sponsors and Republican votes in order to get any of this legislation passed. And that they were able to get, I do believe, multiple Republicans to be on this legislation. That was really, really integral. But as you see, that was introduced in 2021, and we still have not had that passed yet. What was great about it is it also required patient-centered outcomes research to fund and support patient registry, collect their information. We need to make sure that they're researching us and researching us all so that we can find a cure and get treatments. Instead of this slight trickle down of clinical trials that we're seeing now, and with Taliban, and like we're seeing like a tiny bit of research with clinical trials or studies or case studies with a few things. I think Flovin now and Paxlovid, there's a few trickling out, but they're very small trials. We really need to make sure that they're researching us properly, and they're required to research all of us, or else they'll pick and choose to use that money in ways that not necessarily centered on patients, which is why patient-centered outcomes research is really important to us. And of course, it requires multiple agencies to work with each other in the research so that they're sharing data and using it and putting in different government spaces to really utilize the information that they're getting and create changing interagency changes based on the data that is collected. Next slide. And so we the last legislation that we worked on this year was with Rep. Nydia Velasquez, and that was introduced in the House in June of 2021. And so that is the COVID-19 Pandemic Response Centers of Excellence Act. We affectionately just call it the Centers of Excellence Act. So basically, it's establishing funding for these Centers of Excellence. And the Centers of Excellence would be a space that is interdisciplinary, that studies and treats long COVID, and we would be able to go to these centers and they would have very high standards, unlike the hodgepodge centers that a lot of us are experiencing, that are basically just, you go in, you see one person a few months into it, and then they just refer you out. Where the centers of excellence would be a one-stop shop for educated providers to give us care. And so this legislation funds those centers of excellence, and it funds it in a way that picks from the data that we have concerning long COVID to make sure that those centers that are funded are going to be in areas that are needed, and not all like 5 centers in New York and 5 in California, and just makes it hard logistically for us. So it's funded in a way that it would be spread out. As you'll see in the legislation there, about the committee has to facilitate collaboration, information sharing, and dissemination of best practices. And that's what we need. We are all struggling with doctors that have no standards for care for us. And so it's going to be creating a standard of care throughout that area to make sure everyone, regardless of state, red, blue, whichever, rural, will be getting an access to a high standard of care that a lot of us are not having right now. Next slide. So why is legislation not law yet? So currently Democrats have a thin majority control in Congress. So passing any sort of legislation, as some of you guys may know, is extremely difficult. Why? Because there's a rule requiring votes from 60 of the Senate's 100 members in order to advance legislation. So we currently have 50 members of Democrats in there. And so because we have only 50, we don't have the threshold of 60 to just pass legislation without it becoming bipartisan. We need 10 Republicans to sign on to vote for this legislation in order to get it passed to become law. And as it currently is, there's not much pressure on them to actually sign on to these things. And that's why we matter, and the entire community matters, because we can get just 10 out of the other 50 to sign on to this legislation. We can finally start getting those resources, those financial programs that we need, the adequate care that we need, and the proper insurance coverage that we need with long COVID and all the other symptoms, to be covered without us having that extra burden on our shoulders of how we're going to get recovery. And it's also going to help those in the future who become ill, or even our children that have long COVID. It will help them as well if we can get some of this legislation finally passed. Next slide, please. So I'm going to talk to you about my experience with committee hearings and why that matters, and what you guys can do to help get more of these. Next slide. So committee hearings. So a hearing is a meeting or session of the Senate, House, or joint or special committee in Congress. It's usually open to the public, and it's there to get information and opinions on either legislation or just something that they're mulling over, something they want to evaluate and see if they want to dig into to become a legislation, or just have more information in general. As our elected members of Congress, it's important for them to be looking into issues that affect us. So that's why hearings can be just purely exploratory. Like if there could just be something that pops up, they want to have a hearing about it. If that hearing covers that topic, then they'll be able to have a hearing on it. But they all have to vote to open a hearing, to start a hearing. And so a hearing is usually the first step in the process of a public hearing. They just talk about, they'll have a committee meeting and they'll talk about whether or not they want to make up an actual public hearing. And then in the public hearing is when they will bring in people to testify, experts, witnesses, testify on that matter, so that they can really gather a proper whole viewpoint on what's really going on, what topic they're wanting to explore. Next slide, please. So my experience with testifying. So yeah, because I've been doing a lot of work with long COVID advocacy since the very beginning. Some of you may know, I was threatened with arrest for seeking care for my long COVID symptoms back in September of 2020. And that really pushed me into a lot of media interviews. And I've been telling my story and other stories that I experienced as I have really severe MCAS, which is mast cell activation syndrome. And so that prevents me from being able to eat foods, drink water without medication. And I almost died of starvation because of it. And a lot of issues that would have been fine if we had doctors and a center of excellence and those kind of places for me to get care from the beginning. I would not be sick today. So I've gotten so bad that I really struggled breathing air outside, and so can't do I can't do any sort of outside things. I can't do any outside things to 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 really be an advocate in the way that I want to be. And so it was a gamble for me. It was a gamble for me. So they interviewed me and asked me if I wanted to speak in public, but it was a real gamble for me to say yes, because I had not been outside that long for a period of time, and I really risked anaphylaxis from being outside for that period of time. And so I said yes. I felt like they really needed to see me up in close and personal and hear my story and see my face when I tell them that I almost died of starvation unnecessarily, in that we urgently need help and resources. And so yeah, I wrote my speech, I submitted it, and I was sworn in, same way that you see on TV, my hand held up, and I sworn in, and I gave my sworn testimony, which is my experience with long COVID, in front of the select subcommittee of coronavirus. Next slide. So why hearings matter? Okay, so well, before I was speaking, there's a Republican on the subcommittee, Rep. Green. He was making these statements that basically was summing up all of the issues of long COVID being down to doctors not having full autonomy to do whatever they want with patients and treat them without any sort of regulations whatsoever, which completely conflicts with my my testimony, where I was saying that, if it wasn't for the bias um, of doctors in the ER, I would not have suffered and nearly died. In fact, I lost my mobility. I was ended up in a wheelchair from the starvation, from the lack of care. And had the doctors had a standard of care in place, which is what the legislation that we're trying to push for happened, I would not have experienced those things, and I probably would not be sick today. And I could see as I was talking that it was really impacting him. And I could really tell that it changed his approach, like what he was expecting to say as a rebuttal to the witness testimony, which is what they're usually known for. And I could tell that it really changed. He directed, instead of talking to me, he directed his questions to the actual other doctor that testified, and he really kind of like danced around. I could tell he didn't want to engage, because my story is really so profound that he just could not rebut my experience. In fact, he even said that how I was treated was wrong. So I can definitely tell that it changed things. Next slide, please. And so this is why we all need you to sign up for advocacy team and get involved. Your story matters so much. We need more stories out here. We need to pressure these legislators to pass these pieces of legislation that are sitting there. And I'm really looking forward to working with you guys in the future and seeing you around the advocacy spaces. Thank you.
Hi, sorry about that.
So with that, we hand it over to Nisha first, I think, Amy.
Okay.
We're going to Nisha,
and
Nisha's going to go over the first report, which is covering the federal supports and services available to those with long COVID. Nisha?
So, hi everybody, my name is Nisha McCrae and I currently serve as Director of Education for the COVID-19 Long Hauler Advocacy Project. And so I'm gonna take a moment to share my screen before getting started. So as Karen was saying, one of the first things that was released on this past Wednesday regarding the HHS reports, the first report was basically highlighting what resources and support programs are already available for those with long haulers or long COVID. And so what I want to do over the next couple of minutes is to try to do a very high level or top level overview of the resources that the government, or particularly the Biden-Harris administration, has highlighted for those who are currently suffering with long COVID to utilize in order to improve their quality of life and the disease burden at this time. So as you can see here, I have the first 7 in front of us that are the ones that I feel like we should spend the majority of our time today on. So the first thing is something called Know Your Rights, or protection and advocacy systems. So protection and advocacy systems is something you probably haven't heard of. I had never heard of it until I looked at this report, but apparently these are federally mandated agencies that provide a wide range of legal advocacy services to people with disabilities. The purpose of P&A systems, or P&A locales or clinics, is to make sure that people with disabilities have access to anything they need, whether it's to grocery stores, to education, to job placement, access to fair housing, anything you could think of that may be a barrier for you having a decent quality of life. These are one of the things that P&A is supposed to help you with by helping you navigate the red tape and advocate for yourself when someone decides that they will just not rather be bothered with you. So it ensures accessibility, as well as they have a nationwide presence. These protection and advocacy, or P&As, exist in every state in the United States, including in territories in Navajo and Hopi nations, including in the states of Colorado, New Mexico, Arizona, and Utah. One of the ways that the P&A systems or clinics were actually mentioned in this report was they could be utilized in order to address allegations of neglect or abuse, as well as conduct monitoring of long COVID clinics. As we've mentioned earlier in the call, thanks to Cynthia, there's a lot of long COVID clinics and treatment programs, et cetera, that are popping up, and P&A, or protection and advocacy systems, could be utilized in order to make sure they're actually following a treatment plan or a standard of care in order to focus on making sure you, the long COVID patient or caregiver, are getting what you need. The second piece that I wanted to highlight in the federal supports in services for Americans experiencing long COVID is healthcare coverage and access. As we're all very familiar with, the Biden-Harris administration was very gung-ho about expanding the affordable health insurance coverage for Americans during the pandemic. One of the big things about going into 2023 is whether or not that expansion of Obamacare / Biden care is going to happen in order to ensure affordable health insurance is available for those with long COVID who are still requiring consistent access to healthcare at this time. That's one of the things that was actually mentioned in the report as one of the promises by the Biden-Harris administration. The second one is community healthcare. As some of us may know, there's a lot of spaces in our nation, even if you're in an urban area, that are called healthcare deserts. These are places where there's no community clinics, there's no healthcare services within 5 to 10 miles, for example. And most individuals, especially those who are suffering from chronic complex diseases, who are elderly, veterans, et cetera, are just without access to consistent health care, and therefore get delayed tests, diagnoses, and treatments, et cetera, that decrease the quality of life. I'm going to take example of my neighborhood in Roxbury. The average life expectancy of a male who occupies my zip code is 51 years of age. And we're in the #1 city for healthcare, given we have 5 hospitals, world-renowned hospitals in the top 25. And that's where we're at, because we apparently exist in a healthcare desert. So another thing that's going to address that is something called telehealth expansion. Some of you have become very familiar with telehealth over the past couple of years, because telehealth has allowed for us to attend and maintain our doctor appointments or healthcare needs without actually having to risk or having to figure out how to access that healthcare via transportation, and all the associated costs to getting to our doctor's or specialist's office. One of the things mentioned in the report that would be something they're looking to expand upon is telehealth access in order to address this inequality and inaccessible healthcare that is existent for a lot of long COVID patients. The fourth and final major piece of the healthcare coverage and access resources by this first report was the long COVID study and enrollment. One of the things I would like to give a shout out to Representative Ayanna Pressley for is that there is a huge gap in our knowledge regarding what's the actual population of individuals with long COVID. Because how can we start creating treatment plans and future policies if we don't know the size and scope of the problem, let alone what symptoms and experiences long COVID patients are experiencing? So this kind of wraps up the healthcare coverage and access points that was in the first report. Moving on to number 3, which is community services and support. This can be summed up by these 4 main items. I'm not going to go too deep into it because this is kind of straightforward. The first one is assistance with daily living activities. This is helping folks in order to get groceries, helping them find transportation in order to get to doctor's appointments or to get to jobs or whatever they need to around the city. This also includes community economic development, because if you don't have, let's say, bodegas or clinics or things that provide daily needs and services activities, then that's going to make the process of having daily living a lot harder for someone with long COVID. And then last but not least, assistive technologies such as utilizing cell phone apps or other technologies that are cheap and pretty much accessible, and their words in the report, for people to utilize in order to navigate their new realities. I will give a snippet here that this report heavily cites a couple of research studies. In particular, I know in the city of Boston, this is one of the things they're doing in our community in order to make it more, to assist with daily living activities for those who live in underserved communities, is where this section of the report seems to draw the most from. Moving on to the 4th point or section, which is income and financial assistance. This is to address the fact that there's pretty much little to no safety net at this time for those who are suffering from long COVID. You'll see the familiar candidates in terms of ways to get income and financial assistance as you're battling long COVID in the form of disability and survivors benefits, assistance programs for families and children, unemployment benefits, as well as tax and retirement credits or benefits, as ways that those suffering from long COVID or caregivers taking care of those with long COVID could have seen some financial assistance as they're trying to navigate this process. The 5th category mentioned in this first report as federal supports and services for Americans experiencing long COVID would be job assistance. I'll go over this very briefly. This is just trying to find workplace accommodations in order to make sure that you're either able to retain employment or you can actually scale back your hours in order to have some level of income or financial assistance. The 3rd part of the job assistance section was helping you find alternative employment if necessary. For example, your previous job no longer wants to retain you, or there's no possible way that you can work that job on a part-time basis. How do you find other employment opportunities so you still have that income and financial assistance coming in? Moving on to the 6th section, which I know is very important for a lot of our community members, and that's how do I stay in my home and what resources are available for me to stay in my home? And these are the major 4 that were highlighted in the report. The first one is assistance for homeowners. This could be negotiations with the bank or the mortgage lenders in order to provide some kind of grant or waive period of 3 months in order for you to get caught up on your other bills and then continue paying the rest of your mortgage on a regular basis. Assistance for renters, we've already seen in a couple of cities in which there's actually rental assistance programs if you've been heavily impacted by COVID-19 or post-COVID-19 ailments. The 3rd is utilities assistance. As we know, depending on your location, and especially this summer with gas prices, utilities have been a beast. And utilities assistance programs were highlighted in this report in order to help alleviate one of the major headaches and financial drains on households dealing with medical issues at this time. And then last but not least is affordable housing programs as a resource for those that assistance for homeowners, assistance for renters, or utility assistance is not going to provide enough income or enough safety net for folks to stay in their place of residence or in their home. And they're going to have to look for something else that falls into their new budget. So all of these actually come under something called the Fair Housing Act, which is highly referenced in this section of the first report as what the Biden-Harris administration feels will be able to address these issues facing C-19 long haulers who are dealing with how do I stay in my home. The seventh section is food support. As we all know, all living things need four things. They need space, they need shelter, they need actual food and water, and then last but not least, they need some type of nurturing. The food and nutrition support is taking on the nurturing as well as the food and water section. We have probably seen a couple of these programs floating around, especially if you deal with Wild Wild West out there in terms of obtaining long COVID care. Second, federally supported resources for healthcare personnel, including for stress and trauma related to COVID-19. And there has been a lot of stress and trauma in the healthcare space, along with a lot of healthcare personnel, essential workers, and emergency personnel who are also battling long COVID, which is a whole other stress and trauma related to COVID-19. So the report did have an honorable mention of federally supported services for those individuals. Third, healthcare delivery systems equipped for long COVID care. One of the things that anyone who's been to a clinic or hospital in the last year could tell you is that the healthcare system has been buckling, much like it's been buckling in our peer countries over in Europe, as well as a couple of places in Southeast Asia. Our healthcare system has weathered several storms and needs a bit of a support system when it comes to now handling the largest group or mass disabled group in almost a century about to re-enter their facilities. So strengthening and reevaluating healthcare delivery systems, specifically for long COVID care, was also mentioned. And then last but not least, services for individuals coping with mental health issues, including substance and bereavement supports. I don't have to be the one to tell you that most times as a long COVID sufferer, you're not the only one in the family suffering from anything related to COVID-19. A lot of us have also lost family members and loved ones due to a COVID-19 outbreak or infection or wave. And a lot of that has been missing in terms of a moment of pause or a moment to explore how can we cope with our new chronic conditions, as well as how can we cope without turning to certain substances or abusive techniques and methods in order to cope with all that we've been through. And so that seems to be the very quick and dirty roundup of the first HHS report and the long COVID services that the federal government, in particular the Biden-Harris administration, feels that you all should know that they're already doing for you.
Thanks, Nisha. I am going to speak to the National Research Action Plan on long COVID, but first of all, I'm going to cheat and clip my notes up here so I can see you all and talk at the same time. Hi, everyone. I'm Amy Watson. I'm the founder of the first support group specifically for individuals experiencing long COVID, long haul COVID fighters. And I inadvertently coined the term long hauler when members of my groups began identifying as long haulers publicly. And I'll be talking about the first 3 chapters of the National Research Action Plan on long COVID. So the first thing that stood out to many reading this report was the statement that, quote, symptoms persist or emerge weeks or months after the initial phase of infection has passed. At 2 and almost a half years into the pandemic, this messaging is part of the reason the public does not take long COVID seriously. And the fact the majority of us have been sick for over 2 years now continues to be left out of guidance. So this is a point that we intend to address at an upcoming stakeholder meeting. On a positive note, while it's not data that we want to celebrate, the data collected by the COVID-19 Long Hauler Advocacy Project, which was the first data reporting the economic impacts of long COVID, highlighted in their January 2022 open letter, made it into the report. So yay, happy to have that included. The administration acknowledged that 44% who said they had been completely out of work, and the 51% who said they have had to reduce their working hours. That's a significant impact on our economy. Even those of us who have managed to maintain some employment are, underemployed, and where does that leave us as far as being disabled or partially disabled. There is a major victory in acknowledging that long COVID is not just one condition. As stated, quote, represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. While we are incredibly happy, these reports mention the two most common conditions seen in long COVID, dysautonomia being seen at 67% and ME/CFS being seen at 46%. There are many other associated conditions being seen also at percentages that we have found to be as high as 30 to 40%. We must continue educating the public, medical providers, and researchers about these conditions, and we cannot be afraid to name them. There are multiple hypotheses that currently exist regarding the underlying biological processes, including viral persistence, reactivation of other latent viruses, pardon me, other latent viruses such as Epstein-Barr virus, dysregulated immunological and inflammatory responses, and central or peripheral neurological damage, including autonomic dysfunction and inflammation of blood vessels. As long COVID is likely not one singular condition, there will likely be multiple underlying pathophysiologic mechanisms at play. This is incredibly important language that we feel encompasses long COVID and its associated conditions and beyond, such as dysautonomia, ME/CFS, mast cell activation syndrome, autoimmune diseases, fibromyalgia, and many, many more. Many of us have an alphabet soup of diagnoses these days. We want to note that we're still concerned about the amount of language and research we are seeing citing hospitalized cases and severe cases, and believe this is leading to biased data. We continue to see those in the long COVID community reflect around 80 to 85% of non-hospitalized cases. This is, again, something we want to continue to address. There are currently a lot of research gaps when it comes to long COVID and its associated conditions, and a lot of that has to do with the lack of awareness around these conditions in general. Recover is not screening for most of the associated conditions as we had hoped they would. And for those serving on Recover task forces and committees, they continue to fight for that addition weekly in their respective meetings. I have personally collected a lot of new diagnoses over the past 876 days since becoming an early adopter of COVID-19. Like many of you, I spend a ridiculous amount of time and energy just trying to manage my symptoms and have some semblance of a quote unquote normal life. I know you're tired because I am too, so damn tired. Even so, I implore you to dig deep and reach out to your state's lawmakers to make sure that your voice is heard in support of long COVID legislation. This can be as simple as writing an email to your state and congressional representatives, and we can make it even easier for you by letting you copy our homework so that you just need to fill in some of info about your own personal experience with long COVID. You may or may not know that in my real life, I've been a preschool teacher for nearly 30 years. And since the beginning of my COVID journey, I've often thought that as a patient group, we're similar to the Who's in Whoville and Dr. Seuss's Horton Hears a Who. And while no one wants to be the poster child for long COVID, collectively, we have to keep reminding the world that we are here. We are here. And we recognize how fortunate we are to still be here living our precious lives when millions have perished from COVID. Surviving doesn't mean we're thriving though. We need help. So please join me in continuing to make noise and drawing attention to long COVID. And thanks for listening. And I'm going to pass it back to Karen, who's going to continue talking about that report.
So I'm going to talk about chapter 4, which is talking about accelerating research and innovation in long COVID. So two pieces of this are the Recover Initiative, which is an NIH-headed study, and the Inspire study, which is a CDC-headed study. We just recently learned about Inspire and have identified several issues, which we will be addressing, mainly surrounding symptoms in this study, which it's screening. There are about only a handful which it is addressing, which are all acute symptoms. Moving on to Recover, which many of you are familiar with. It is a much larger study and it collects much more information. One thing Recover has not done well is clearly and strategically communicate with the patient population. Recover sites are studying adults, pediatrics, pregnant women, and tissue samples. They are studying long haulers and healthy controls, meaning those never infected with COVID-19. Unfortunately, many sites have already met their enrollment criteria for long haulers. However, there are sites still enrolling long haulers. Other sites are enrolling only acute cases. Just to pause for a second, somebody in the Q&A before had asked if Recover was only enrolling long haulers up to 24 months. The COVID-19 Long Hauler Advocacy Project had fought very hard to extend that to 36 months. That was something that we were able to revise. We did get that win, and long haulers up now to 36 months are able to enroll in Recover. So if you are being told that you are not able to enroll in Recover out till 36 months, please let us know. At this point, I believe there's only 1 or 2 sites that are still trying to revise their internal protocols, but all sites should be enrolling out to 36 months unless they have already met their internal enrollment criteria of the number of long haulers they were trying to enroll. Recover is offering 3 tiers of testing to select participants, but Recover is not offering medical care. This is something that disappointed the community, understandably, and what we felt led the community or started the community disengagement. However, it is important to note that Recover is serving as a data collection hub, and this is what we feel the community does not understand. There are hundreds of researchers applying to Recover to do research with the data that they are collecting from all of you. This research, much of what I have personally reviewed, is expanding to conditions associated with long COVID, and that is something that we should applaud. It is through this research that we refer to as ancillary studies that I believe we will find answers to long COVID and its associated conditions, whether through Recover or through another form of research mechanism like the Long COVID Research Fund or other privately funded studies. The biggest takeaway from this part of the study, that the reports that came out, is the establishment of an office for long COVID research and practice. So this is to lead efforts across the US government. So if you look on the screen here, I'm going to go through these point by point, and some of these are long, but I think it's really important to go through these step by step to make sure that we all understand how large of a project that this can be and why we all really need to be all hands on deck. And I just want to point out that, and I'll get to why we need to be all hands on deck at the end of this. But this is, I think, the administration's promise or commitment to a long-term commitment to addressing long COVID for us, right? So they're making a permanent office of long COVID research and practice, which means they're appointing somebody to lead this. And we're going to have multiple offices within the administration working collaboratively to ensure that we're researching long COVID and we're figuring out the answers to long COVID. So this office will harmonize an approach in US government-sponsored long COVID cohort research to include measurement of the broader impacts of the disease, such as development, education, employment, disability, and health-related quality of life. It will incorporate the voices of patients and others with lived experiences into research from inception to completion and including dissemination. The coordinator will comprehensively place the lived experiences of patients at the core of the research enterprise to inform development of research priorities, research design, execution, interpretation, and dissemination. It will implement strategies to measure and mitigate inequities in long COVID. It will identify strategic collaborations between public and private entities needed to accelerate long COVID diagnostic and therapeutic research and identify and address barriers to collaborations. Next slide. It will further harmonization of and consensus of clinical care, surveillance, and research definitions of long COVID described above, translate research into evidence and guidance, develop and implement a strategic communications plan to share findings from long COVID research, including evidence-based guidance with the broader research community, including public and private research institutions, federal and state policymakers, healthcare rehabilitation payers, industry, patients, caregivers, and advocates. Broadly share US government researchers on long COVID, establish a framework for a multi-pronged approach to long COVID surveillance, build on existing programs and infrastructure to improve systems and strategies for rapid implementation of clinical trials to test existing and new diagnostic tests and therapies for long COVID. Next slide. Engage US government agencies to contribute to a coordinated effort for a national real-world evidence approach, which would include long COVID. Develop a network of long COVID centers of excellence to integrate gold standard patient engaged care delivery and research. So looping back, you see where that centers of excellence bill comes in and why we need that passed, because it relates to some of the things that are going on here. Establish primary care networks to develop, implement, evaluate, and scale person-centered models of care to enable primary care to prevent, diagnose, and manage long COVID, and continue to prioritize the recruitment and retention of investigators tackling interdisciplinary long COVID research. So, what is the bad news? As stated in the release of these reports, there is no staffing or funding for this office, which means now more than ever, it is of utmost importance for us to organize, strategize, and target our lawmakers to ensure that we can obtain the signatures and support necessary for the passing of legislation and funding we need for help and success to reach us, our families, and our communities. We will work to build the foundations and give you guys the tools necessary to do that, and ask you to stand with us and support us by joining our advocacy teams and help us with whatever you're able to do, whether that be as a team leader or as somebody who retweets a post here and there or completes a resist spot. Everyone's involvement in some capacity matters, but we need community engagement and community involvement to move all of these projects and all of these efforts forward, even if that means tagging a friend and saying, hey, can you help me get 2 more people to help with this effort, whatever it may be. But there is a lot going on, but nothing will get done if we don't have the community's backing to do this. So that's where we're turning to you guys and asking for all of your help in understanding where we are and what has to get done in order for us to receive help. So with that, I'm going to turn it over to Michael now. So thank you guys.
All right. Thank you, ladies. Thank you, ladies. So we only have a few minutes left until 5, but I think we might run a little bit over. So if you all can hang in there with us, we got a little Q&A section here with all of our panelists, and you all have been asking questions in the Q&A on the chat, so you can continue to do that, and we'll try to respond to those. And also, please, I'll make a plug to engage with us on all the social media sites: Facebook, Twitter, Instagram, LinkedIn, whatever we're on all of them, I think. But yeah, so thank you once again for everybody. I know it's given us this 2.5-year recap of where we've been and where we are now, and there's a lot in this legislation that's out there, and these reports are a lot to digest, especially for people low on spoons and struggling cognitively to get through and understand all this. We hope that this session is helpful today, and that we have stressed the need for overall engagement and why it matters for you to be involved and to raise your voices. Nothing happens without us, and our involvement as leadership are in need of your support now as the community at large. With that said, we're going to go around and ask some follow-up questions and closing questions to the panelists. So, starting with Cynthia. Many of us watched the hearing you testified in a couple of weeks ago, and it was quite obvious the lack of knowledge about long COVID our lawmakers have, unfortunately. How could the community engage more lawmakers to ensure our stories and our needs are making it to them to encourage or force them to act on long COVID? Cynthia?
That's a great question. Telling your story in any way is really, really important. Putting it on social media is important. Tagging them, I do it all the time, on Twitter so they can see what our experience is very, very important. And if you are persistent, you can really get those meetings. Ask for what you want. Clearly, hey, do I want a meeting with you? Hey, I would love to talk to you about this. On social media, or you can go to their portals of their own web page. Every legislator has their own portal where you can contact them. I did that with the Ayanna Pressley team, and that sped up my contact with them to tell them my story. So it does actually work. I was tweeting Ayanna Pressley a lot. Whenever she would post about long COVID, I would just write comments, hey, I need to tell you my story. Hey, I need to tell you my story. So they finally reached out to me. Social media is a great way to get in contact and get your story in front of legislators that are interested. And it's a great way to also pressure those that don't want to be involved in it or have been hesitant to be involved with signing these legislation, targeting them social media and saying, why are you working on this? Why are you working on this? Why are you not helping us? Why are you not helping us? Helps. And of course, joining your local advocacy team. We have a huge, C-19LAP has a huge, just a variety of teams to join. And it's available on the website to check out which team matters to you. So you can put forth your collective stories together. We can all make it work really well.
All right, Cynthia, thank you. Any more to add there? I just wanted to make sure you didn't go on mute by accident.
Oh yeah, I was done. Thank you.
Okay, cool. All right, and I'd echo, what Cynthia said about really, the basic question is how can we get our representatives to listen to us? You got to be persistent and you got to reach out to them. And the remarkable thing is, when you do contact them and you contact them enough, very often they will get back to you. Sometimes you get the really long auto reply email from the office that says, thank you for reaching out to us. And they'll give you, a 5-minute email of not what you wanted to hear, but you keep pressuring them and keep at it and, you'll get through. So going to Nisha, there are a lot of resources included in this first report, but it appears many of them are still unattainable or not helpful for many long haulers. What can long haulers do to raise awareness about these supports not being enough? And how do we work together to advocate to expand supports desperately needed?
Thank you so much, Michael. I would say I can tell you firsthand that a lot of the supports and services or federal supported services highlighted in the first HHS report were things that I have experience with pre-COVID as an educator, as well as a caregiver of somebody with a complex chronic condition, as well as experience post as a long hauler. And me personally, I'm gonna focus on the housing issue. The affordable housing program has had a lot of issues the past decade, if not more. And I can say one of the things that has affected a lot of my students as an educator before COVID actually hit the United States was the Fair Housing Act has a lot of loopholes, as well as affordable housing programs have a lot of loopholes that leave vulnerable communities and populations still struggling to find shelter when there's supposedly a huge inventory of empty units available that should be accepting Section 8 vouchers or should be participating in the program. And I think while from the government side, they think everything's hunky-dory, there's still a lot of things that were proposed in the first report that we all know, regardless of if it was education, early childhood, job placement, all of these areas that they're proposing are already available to you as a long hauler. We know the faults and cracks and how inaccessible these things are. I would say, going along with what Cynthia mentioned earlier, is talking to your local lawmakers. I was speaking with Representative Ayanna Pressley a couple of weeks ago and her team, and they were shocked to find out that the City of Boston's rental assistance program hasn't paid out any rental assistance in over 8 months. And this is a program that's been highlighted by now one of the Department of Labor the head of Department of Labor and former mayor of the city of Boston, is proposing as one of the key programs to alleviate the pressures on long COVID patients and caregivers. And so not only talk to lawmakers to go, hey, remember that piece of legislation that you were so proud of and the federal government likes to always throw up in our face as a resource. Well, I'm not getting it, and multiple people I know are not getting it. Here are their names. I'm pretty sure they'll be glad to talk to you. I would say the second thing is my experience in education has led me to believe that a lot of federal government programs rely on what they think works theoretically, and they have very little experience of how those programs or resources play out in reality. And one of the things my community has had to get quite good at is showcasing and scrapping together all of our resources together as a community and showing what we actually need. And I think the best example of that would be food distribution programs for children, families, seniors, and those with disabilities, veterans, et cetera, who have been traditionally underserved by food distribution programs that are federally supported. And us going, hey, so-and-so has a school bus. We also know so-and-so has a farm with leftover produce. Tuesdays and Fridays, we will distribute these food baskets for those on a first come, first served basis. And after 2 years of doing that in the pandemic, we finally got local and state support to actually have that distribution program happen at almost every school site within the city and several community church sites, and now is funded with the COVID relief funds from over 2 years ago. So the second thing would be, if there's a lawmaker who's not listening and you have a community of long haulers you can identify through the state advocacy team Facebook pages that are available to you with C-19LAP, one of the things you all could do as a community, and we'll be willing to help, is figuring out which of these things do you want to tackle and how can you make a pilot or a template that the government can realize is how this is supposed to happen in order to guide that actual policy. So those are the two things I think are how to address it. But I was at least happy they knew what resources existed in their various departments. But a lot of them I was like, oh, they didn't talk to anybody about what has been long haulers' experience going through these particular hoops and valleys and red tape to get assistance.
Excellent. Thank you. Thank you, Nisha. We are going to jump to Amy now. So Amy, talk to us about what it means to have long COVID's associated conditions such as dysautonomia, ME/CFS, mast cell activation, fibromyalgia, and the many, many more finally recognized as part of long COVID for not only long haulers, but those in these communities as well.
I've been telling every medical professional and researcher that I've interacted with the last 2 years and 4 months that validation is everything. And it has to be the starting point when we're talking about even just figuring out what's going on with an individual. You have to start by validating, not like, oh, did you ever have a positive test? I don't see, there were, a lot of us got sick in March 2020. There weren't tests available. I somehow managed to get a test 4 weeks after I was first infected and tested positive on day 28. And I'm lucky to have that as part of my medical record because it has, quashed any doubt about whether or not COVID had a role in the development of all of these bizarro new conditions that I have. The other thing I had going for me, which is a weird way to frame that, I don't know how else to say it. I've had endometriosis since I was a teenager. And so I've been living with an invisible chronic illness for decades. And that has given me sort of a leg up as far as advocating for myself within my healthcare system, because I know how to get help and how to be a squeaky wheel and how to push forward. But it's exhausting. I get it. And I see so many members of my support groups who have just given up. They've just been gaslit and turned away and, misguided and just, jumped through all the hoops and aren't getting anywhere and aren't getting any better. And I hear that. I hear how incredibly frustrating and exhausting that is. And we each have to figure out what is the best use of the resources and the limited spoons that we have available to us. And I'm a big fan of the greater good, and that to many voices coming together will benefit all of us. So although I am in my real life a total introvert and completely way out of my comfort zone and wheelhouse doing all of this advocacy stuff, it matters so much for every one of us. So I would just encourage you to demand validation, because I mean, we have our government's backing here saying that what we are experiencing is real. And if you have doctors who are not on board, boy, they need to get on board quick, or you got to find another doctor. And I know that's easier said than done some places, especially in rural areas. I happen to live in Oregon, where there are 0 recover sites, and having worked on the development of that program, I gotta tell you, really super disappointed that I don't get to participate in that research. And I also was admitted to an NIH neurological study that got defunded because of funds being diverted into the Recover program. So I never got to go to Bethesda and participate in that study either, after waiting months and months to get my approval for that. So I get it, it's frustrating, but take a moment, take a pause, take a deep breath, and sit down and channel that frustration into a heartfelt email to your local state representative, senator, anybody who will listen, and tell them your story and keep telling it. I've told my story plenty. My job now, I feel like, is to elevate other voices and give other people opportunities to share their stories. And we just have to keep making noise. So, I mean, I cannot believe that there's no public, health advertisements. Why are we not seeing billboards on the freeway about long COVID? So, because we're just pretending COVID is over. It's not. So that's my 2 bits for you.
Thank you, Amy. And I'd add, and this again is easier said than done, but the more that we all can find help and find care and just tell our stories and get whatever testing is available done, that will be critical. Even if you don't have a major institution nearby, just we have lots of resources available. You can connect with those on the Facebook pages. Amy knows from our original group, I mean, God, how much good advice did we share with each other since March 2020? I mean, a lot of my foundational knowledge was built from Amy's group, for people sharing ideas and things that worked. And I've brought that to many of my doctors, who have then gone on to recommend tests and stuff to other patients. I've had a lot of my doctors tell me that stuff that I brought to them, they now do to their patients who are coming in sick with COVID. So it's, there is a ripple effect that you can have if you, and I know we're all low on energy, but you just got to keep doing whatever you can to push for tests, to share your story, and anything that you can do to get the message out there. Because this should be on the news cycle 24/7, but there's obviously other sexier things out there happening right now than us long COVID people. But the more we can continue elevating this message, the better off we're going to be.
I totally agree, Michael. Yeah. That I have my primary care physician is the head of the post-acute sequela clinic through Kaiser Permanente here in Oregon. And I was talking to her about the immunologist I've been working with, who was doubting my MCAS diagnosis. And I loved it that she was like, he said he's only had 2 patients out of 100 that he's ever tested have tested positive for MCAS via a tryptase level. And my doctor said, well, that was before COVID. And she was like, I will be speaking with him and setting him straight. So I hope that, that ripple effect is going to benefit other patients as well.
Yeah. And even just to give everybody another quick example, and then we'll go to Karen. at my 2-year mark, I actually had a cardiologist do a cardiac MRI. And 2 years afterwards, that's where they discovered that I had heart scarring from myocarditis from my COVID infection. And this was 2 years after I was first sick. And ever since then, I still check in with my cardiologist, and he told me last time I talked to him that he has recommended the cardiac MRI for a lot of his COVID patients, because a lot of times, as many of you probably know, that scarring doesn't get picked up on X-rays or CT scans. So you need the more sensitive cardiac MRI to find that. So just as an example, even 2 years after this all started, you can still potentially help others get care. And also, and the more that doctors push for these tests for others, the better that's going to elevate, the awareness of these conditions and these things that happen. So keep pushing. So going to Karen, the formation of the Office of Long COVID Research and Practice sounds like a long-term commitment from the administration, but in the absence of staffing and funding, what does that mean for us? And what do we have to do to ensure this office is actually formed, run successfully, and sustained?
Yeah, I mean, it makes us really happy to hear that, this is going to be a long-term commitment, but it makes me really nervous knowing that we don't necessarily have funding assigned yet, right? It makes me nervous knowing that we currently right now are seeing community disengagement, right? And I know that we're all struggling, and that it's very stressful handling what we go through on a daily basis, and knowing just how much, like, for example, I've been sick since March 2020. I know Amy's my COVID twin. We call each other our COVID twins. We got COVID on the exact same day, March 15th, 2020. And so, it's been really difficult. Some of you might have seen me post today. I just got my workers' comp benefits denied once again today, that I found in the mailbox. So it's been a really difficult road, and people are navigating a lot in their personal lives in addition to navigating chronic illness. And I know that us asking you to advocate in addition to that is a lot, but at the same time, advocating is also sometimes the way out of some of these situations. And it's a lot to ask for, but at the same time, a lot of our lawmakers are not going to act on your behalf unless they're hearing from you, unless you're contacting them, and they don't see it as something they need to spend time on, that they need their staffers to look into, that they need to draft legislation on, that they need to spend time seeking votes for during election years, right? Because we're talking about an election year this year in 2 years. That they need to spend time on, and what they need to hear is from you. And while we have all this legislation out there, the issue is it's just sitting on desks. I think right now for the Treat Long COVID Act, what do we have, Cynthia? 36 sign-ons for the Treat Long COVID Act. So we have 36 sign-ons. We can easily have a lot more if people were reaching out to their lawmakers. So what we need is more community engagement of that push. What we can do as advocacy organizations is give you draft language of you guys to just email out to them, right? And if you get a response, reach out to us and say, hey, so-and-so's office wants to have a meeting, do you want to walk me through a training, or do you guys want to do this meeting for us, or whatever the case may be. We can arrange all of these things for you, right? It's not necessarily on you, but we're asking you to help us initiate some of these communications or these actions. What we need is lawmakers hearing from their constituents, right? A lot of lawmakers see sometimes sometimes it's harmful, right? You see Cynthia talking a lot, you see me talking a lot, you see Amy talking a lot. Sometimes it's harmful for lawmakers to see the same people talking over and over and over again. They want to see their constituents, right? Representative Presley wants to see people in her district. You know, Amy's representatives want to see people in her district. Wherever you are, your representative wants to hear you. They want to know how it's impacting your job, your economy, your children in their school district. How is it impacting your child's learning, and so on and so forth, right? We're talking about kids going back to school, and not only long COVID, right? We're talking about other epidemics or pandemics that are coming up, monkeypox, and potentially, you know, we're seeing polio cases and wastewater in New York City. So it's not only about long COVID, it's about organizing as a community and raising awareness about coming together, about doing what we need to do to stay safe. And a lot of that has to do with, again, organizing. And sometimes it takes spending one spoon in the long run to save 40 more, right? So I hope that people took away some helpful tips today. I know we kind of threw a wrench to some of you, or we kind of gave this comprehensive overview, but I think that just during the reports out to some of you today, we kind of had to let you know where some of the legislation is, where we started, what this legislation means for some of what the reports meant. Because again, we're going to need legislation to support the funding for these reports for this long-term long COVID research and practice. So if we don't have that, if we don't have the funding, if we don't have the community support for our legislators to sign on and support that, we're not going to see successful outcomes from that. So that is why we try to wrap all of this together for you guys today, to get you to understand that process and what community engagement means for our successful outcomes, for our futures, not only for us, but for our families, for our communities. So I hope that this was this helped for you guys today. I hope that we broke some of this down for you. Maybe in the next week or two, we can do like a Q&A session. We will probably throw this together on a YouTube for you guys so that the community has better access to this. Please give us a couple of days to do that. We are going to probably take a couple of rest days after this today, so please bear with us. We thank all of you again. Thank you, Michael, Cynthia, Nisha, Amy. Thank you, everybody who joined us today. We apologize for going over time. This was our first Zoom. Please bear with us. And thank you to everybody, if you were on this call, who helped share and who helped, anybody who helped donate to help us obtain the Zoom account. Thank you so very much for everyone who helped do that. Again, we greatly appreciate you, and have a great rest of your weekend.